Orthopedics in and of itself really drew me from a young age. It's an exciting field. I think one of the great things about orthopedics and specifically shoulder and elbow surgery is we can make tangible improvements in patients' life and quality of lives every day. And it doesn't necessarily have to be, it can be as simple as sending someone to physical therapy to get a rotator cuff tendonitis problem or doing some big reconstructive surgery. We're making improvements and people are able to get back quality of life, and there's a tangible result at the end of that. Probably the most common conditions that I see are rotator cuff pathology as well as arthritis and degenerative conditions of the shoulder and elbow. The rotator cuff is incredibly common to have problems with as we get older. There's been a lot of research done at WashU about the natural history of rotator cuff tears. And we know that as we get older, they break down and can have problems. And treatments can be a variety of things, from non-operative management to physical therapy to injections to ultimately surgery or even replacement of the shoulder. There are very few places in the country that have everything that WashU and Barnes-Jewish have to offer. Whether it's for a simple thing like a rotator cuff tear or a more complex medical problem, we are able to cater to our patients' every need. I think a lot of people get intimidated by the university and by the big hospital and thinking that their problem is not big enough or their problem is not complex enough to come here. And that is far away from the truth. Coming to the doctor can be very nerve-wracking for people. And I want to lay a lot of those nerves and anxiety at rest as soon as I walk in the room. And I want my patients to know that I will listen to them and I will try to figure out the best treatment plan for them. I always tell my patients I'm a surgeon, I love operating. But a lot of times, and most of the time, I have to convince people that they don't need an operation. And really, taking the time to go through things with them and to understand what their needs are, what their goals are, and what the appropriate treatment is for them. And so I think that, as I've said, my biggest philosophy with patients are they come first, and whatever they need from me, I will be happy to provide for them.